Welcome to today's PAWSCAST.
Hi everybody, I'm Dr. Amanda Vandeveer and I'm here with Marcy Childs, therapist at CAPS here at Frostburg. And today we're going to talk about social anxiety. So I'm sure we've all experienced social anxiety at some point where we're like, ooh, speech class where you have to get up and give a speech, or like you go into a place and you don't know anybody. Like all of those things can be a little triggering and give you that little palpitation in the heart, in the chest area, and the rumble and the tumble.
Yep.
You know, that can definitely be going on. So it is a common experience for people now, especially after the pandemic has contributed to that too. So can you tell us more about social anxiety and how would you define and describe it?
Yeah, well, I mean, you make a good point. We know we've started to look at the numbers now, and we've seen, you know, the evidence that the COVID pandemic had a huge impact on not only the numbers of cases being reported of social anxiety, but also the severity of cases. And certainly we deal with that a lot over at CAPS, where students are saying, you know, I was online for 2 years and now to suddenly be on a college campus, no less, with other people, it's just a little overwhelming to go from, you know, 0 to 60 that way. So, but social anxiety generally is described as experiencing symptoms of physiological distress. So that might be like you mentioned a couple, that rapid heartbeat, the rumbling tummy thing. Some people feel dizzy. There are also like cognitive symptoms people can experience. Some people actually experience derealization or depersonalization as one of the, I guess, more severe cognitive symptoms. And emotional symptoms. I think that's probably where it hits us the hardest, because for a lot of people, you become panicked, you become overwhelmed in the moment. A lot of people feel frustrated, feel angry at themselves, kind of beat themselves up for it. And of course, there's that overriding sense of just fear and anxiety at being around other people. Now we do, social anxiety in the DSM is defined as those types of symptoms that last for more than 6 months. And those symptoms have to disrupt the person's ability to get through their day-to-day life. So if you go through those types of things when you get in a group of people that you don't know or in, you know, a provoking situation, but you don't find that it impacts your ability to get to your classes or to go to work or to meet up with your friends, you know, for a sporting event, then you're probably not at what we would call a clinical level. When you start to notice, oh, you're avoiding going to class because, oh, there's like 50 people in this class and it's a really close space and I'm nowhere near the door. So when you start noticing you're avoiding those certain situations, then you might be looking at, you know, what we would call a clinical level of experiencing symptoms. There's also an offshoot of social anxiety. It's actually, it falls under the umbrella of social anxiety disorder, but it's kind of set apart. It's called performance anxiety. Because for some people, they might not experience any of the typical symptoms of when I get in a group of people, I get panicky or nervous, or when I meet someone new, I get tongue-tied and they might not deal with any of those types of symptoms, but when they get up to give a presentation or they, you know, for whatever reason, they have to stand up in class and read a passage, or then they notice that that's when they really start to feel those symptoms of kind of like the panic, shortness of breath, dry mouth, rapid heartbeat. And again, some of those cognitive symptoms, like actually feeling like you're stepping outside of yourself with like depersonalization and that sort of thing. So you can have just the performance anxiety piece without the issues in other social realms, but it all falls under that umbrella of social anxiety disorder.
Well, that was a really good description, and I think a lot of people can really relate to that. Like performance anxiety is very much present, especially I remember like being a teen and in my early 20s, I definitely had it, but I can still go back into it from time to time, even afterwards. And you mentioned like after the pandemic, my goodness, when things started opening up, I'm extroverted, I'm very outgoing type of person. And even like going back into a restaurant the first time after, I was like, ooh, this is a little uncomfortable. Need to breathe.
Yeah, and I think it's interesting too that this didn't just seem to impact younger people who are still kind of building their social skill sets and that sort of thing. Even those of us who are middle-aged and older struggled after only having dealt with it for a couple of years in terms of being isolated. Suddenly we were like readjusting to just what it means to make small talk with the cashier at the grocery store. And I think a lot of us were kind of taken aback at that. Like, wait a minute, I've lived this many years without isolating during a pandemic, and I did just fine. Why am I struggling so much now? Yeah. But it's one of those things, social skills, we kind of take them for granted. And if we're not using them, we start to lose them.
Yeah, it's amazing how quickly. So, yeah. So what is it like to feel social anxiety? You mentioned derealization, depersonalization. Can you describe some more about that?
Sure.
And the other stuff?
I always go to, mentioning depersonalization because just in a moment of self-disclosure, I struggle a great deal with performance anxiety. Not as much with the social situations kind of social anxiety. And one of the things I experience is I'll stand up to start talking, and I can literally, it's like I'm standing outside myself, watching myself talking, but I have no control over the situation, which was always kind of like what just, I don't know, kind of lended itself to a little more panic, and then it created more anxiety. And for me, that would snowball very quickly into my mouth would start to dry out, my, breathing was very short and rapid, and so I'd start to feel, kind of funny, kind of dizzy. And certainly I think the physiological symptoms are what people notice the most prominently. Symptoms of a panic attack probably get your attention a little quicker than, oh, I'm feeling kind of nervous about being in this group. Something about when we start feeling things in our body really gets our attention. Yeah. And so, and again, this may be a thing where, some folks may struggle with the physiological symptoms, some folks may not. It's just one of the possibilities. I know I've worked with students before who didn't have any of those issues, but still could not interact in a social situation, would actually shut down and not be able to interact, would not be able to talk. And that's something called selective mutism, which it's not very common, but there are some people who do experience that. And it's almost like they go inward, in that whole fight or flight, range of possibilities, they kind of flee to within, and go back to like their core in a way. And certainly I think one of the other things in terms of ways that we feel it would be the emotional, I think runs a pretty close second to getting your attention beyond the physiological, because so many people, it makes you very sad, it makes you very depressed, it makes you incredibly frustrated. Yeah. You may have given yourself a good talk up before you decided to try to go to this party tonight. You may have done everything you could to prepare, you meditated a little, you took a warm bath, you did some positive self-talk, and you got there and still were not able to feel comfortable, or even get to the point where you felt like you were able to function, in that situation. And so I think for a lot of people, frustration has got to be one of the biggest, emotional consequences of social anxiety.
Oh, absolutely. And thank you for your honesty and sharing that with us. I really appreciate it.
Absolutely. Yeah, it does me a lot of good because I've run one social anxiety group out here through CAPS, which I got laughed at a little bit for that proposition, but I'll have you know that it was one of the best attended groups they've had.
I bet it was.
Yeah, because something happens when you're able to walk into a room and know that these other folks are also struggling with a lot of the same stuff I'm struggling with. And honestly, I had to disclose it to the students I was working with because they were seeing me go through the symptoms. I was short of breath and having trouble talking, and my voice was trembling. So my great introduction to them was, hi, I'm not only the president, but I'm also a member. It was like, so yeah, I get where you're, I get this as a professional, and I also get it on a very personal level. And so we were able to have a really good experience with that. But it is one of those things where I might not otherwise disclose that information. Yeah. They were literally seeing it all over my face. Right. So it was probably in the best interest of the group at that point that I disclosed that.
Yeah, and in that moment, like, there's no hiding it. You just have to be authentic and honest about it. Like, here I am, this is me. Yeah. And it was probably very helpful for them, too, to see, like, it's not just me, this little student who doesn't know what I'm doing. It's professionals. Like, it impacts everybody across all fields, across all ages, races, genders. It affects people across the board.
Yeah. It literally is one of those things, we talk about addiction being a lot like that, where
Mm-hmm.
it's like, equal playing ground, like nobody seems to escape, no group of people seems to be immune to
Mm-hmm.
the effects. And I think social anxiety disorder is a lot like that.
Very much so.
And particularly not only with COVID, but with the, birth and growth of social media and
Mm-hmm.
how that's affected things.
Yeah.
That's definitely changed up the paradigm a lot.
Yeah. And in my research with addictions, I see that a lot. There's a lot of social anxiety for people who experience addiction. So that actually leads them to trying to self-medicate with drugs and alcohol to fit into the group, to be able to socialize, and then it goes horribly wrong for them. So, yeah.
Well, and I think I've heard, is it alcohol they used to call social lubricant?
Yes,
I think was the nickname
yes.
for it. And it was very much used that way,
Yeah.
and still is, I'm
Yeah.
sure. But so yeah, we do
That
a lot of our
is not a good
socializing
way to
is
do it.
right, not recommended as the way to cope with it.
Yeah.
But the reality of it is a lot of folks go to that before they, they call it pre-gaming, right? Like before you go out for a night at the bar with your friends, like taking the edge off. And it's kind of like you said, it's self-medicating.
Yeah.
But that tells you how awful it feels to deal with, the anxiety symptoms.
Yeah.
So
Yeah, absolutely. And don't forget to check out our PAWSCAST on addiction. You can look in the title, under the title, and it'll be there. We'll have a link for you there. So yeah, it's a whole bunch of stuff going on when you're feeling it, when you're experiencing it. And trying to self-medicate is definitely not the answer. It does not help long term.
it does not help in the long game. No, it just brings a lot more problems usually.
Yeah, and it sounds like social anxiety really impacts someone on the daily living scale, like across the board in their lifetime too.
Yeah. And I mean, it varies. Like there are, situations where someone might feel increased anxiety, say going to like a party where you don't know a lot of the people there, versus going to a place where you work day in and day out, well, that's within my comfort zone because I'm familiar with the people here. I know what I'm doing in my role as whatever your job is. There are less unknown variables floating around with a situation like that. But certainly folks who tend to be diagnosed with social anxiety disorder struggle throughout their lifetime with it. It never like completely, abates for them. It does crop up from time to time, even for people who receive treatment for it. Hopefully it's a little bit more manageable.
Yeah. Yeah, absolutely. So what can a person do to combat this? How can you fight it without alcohol or drugs?
Yes, well, let's get some alternatives and probably more recommended treatments.
Yes.
As with so many things, the gold standard is a mix of medication and talk therapy. It's one of those things where I always say, well, let's go the path of least invasive. Maybe start with some talk therapy. Try to work on some different techniques you can use to modify things for yourself. And then certainly if you're not noticing you're getting to where you need to be or want to be, then look at maybe adding a medication. Right now, the medications that are most commonly used to treat social anxiety disorder are antidepressants, anti-anxiety medications, and then oftentimes they use beta blockers, which they tend to do that more with the performance anxiety type of anxiety. I think that's kind of turned out to be something in recent years they've discovered works really well for that particular type of social anxiety. But then again, cognitive behavioral therapy, I always look this up and I always know what the answer is going to be because it just seems to be, again, it wins the horse race when it comes to what we think is the best treatment approach and what's got the most evidence, supporting it as a treatment approach. There is another newer treatment model. It's called acceptance and challenge therapy, I believe. It's a little different than CBT in that with cognitive behavioral, we would want to look at irrational thoughts and then working on changing those irrational thoughts around the situation. My impression, and I'm no expert in ACT, I don't even know that much about it yet, but my impression is that they don't deal so much in trying to change the active thoughts. It's more about just accepting, okay, this is what's going on with me. And then challenging yourself to find a new way through a lot of meditation practices and that sort of thing.
Including mindfulness.
Yes, definitely mindfulness. So from what I read, it's something of a spin-off of cognitive behavioral therapy, but it does take a slightly different approach.
Yeah.
But yeah, and again, combinations of medications and talk therapy seem to be the gold standard.
Yeah, and that makes sense. So that's something we would explore through counseling, right?
Mm-hmm.
So signing up.
Yes.
They have
Yes.
the counseling center.
And we are not offering the group, the social anxiety group this semester, but I'm hoping to do that one again in the spring.
Okay.
It kind of takes, what I've done so far is take partly a psychoeducational approach, like you're gonna feel a little bit like you're in another class because you're taking notes on different techniques you can use and different things like that. But we also take some time to do skills practice in there and a little bit of time to do some process stuff. So like, folks will come in and say, well, oh my gosh, I had this situation earlier. And then we kind of give them an opportunity to process how they feel and, work with one another in that way. But unfortunately, I'm not doing it this semester. I probably will in the spring. So we definitely invite folks to try the group thing because it gives you such a unique opportunity to interact with other people who deal with the same, the same difficulties that you do. But certainly all of our counselors are qualified to work with social anxiety. And then, of course, we have a prescriber that students can meet with if that's something they would like to look at, maybe doing medication therapies.
Yeah. And of course, the SAFE office, you can come and talk to us too. We always have somebody available for you to talk to. We can help you with mindfulness, meditation. We can talk to you about some life skills and stuff like that. So it's even a pre-step to maybe CAPS.
Yeah.
So I think it's important because we're not just, it's a requirement of your time and your energy, but it's a life skill. It's not just you're going to use it while you're here for that semester. You're going to be using it for the rest of your life to be able to accomplish things, because if you want to get up and be able to present for your job or to be able to talk to customers or talk to your boss, like these are things that are life skills that are important for you to have throughout the rest of your life in your career. So yeah, it is an investment.
You're always going to have new and novel situations that you walk into, whether it's a new job you're interviewing for or a new member of the family comes into the family, marries your kid, whatever. Like you're always going to have novel social situations.
Right.
So even though we can get comfortable with where we're at and kind of learn to, then the next challenge is going to come along.
Yeah.
So it's wonderful to have kind of that toolbox of, different tools that you can use in each of those situations throughout the course of your life. Like you said, these things don't expire. So it is definitely a valuable thing for anyone, in particular for people who are going into jobs where giving presentations may be a big part of their, work.
Yeah.
And so, I think for some, it's an even more valuable consideration than for other people who may not, do as much of that type of thing.
Yeah. And that's what I love about the SAFE office. I'm plugging it again. I know, I'm sorry. But you have the opportunity, should you become a peer counselor with the SAFE office, you have the opportunity to design and present your own presentations on whatever you want to present on, as long as it's about health, healing, happiness, the values that the SAFE office presents. So there's tons of opportunities to even push yourself on campus. And that's just with us. Of course, there are many other opportunities across campus that you can check out that will give you the opportunity to present and push yourself out of those comfort zones, because those comfort zones disappear over time. That's a really good point. They are not permanent. So what can we do if we have friends that we notice are really socially anxious and are like, I can't do that. I can't go out with you to that party. I can't go to that event. I can't do that.
It's one of the toughest positions to be in is when someone you care about struggles with something like that, because I think we often wonder, do I push them to give the good old college try? Should I give them space? Should I back off? And I think the place to start with would be to just have a very candid conversation and bring yourself authentically to that conversation and let that person know, hey, whatever it is you need, I'm here to support you. Whatever that support may look like. If you need me to like cancel our plans at the last minute because, you know, you're not feeling like being in a group, then we can do that, or we can come up with an alternative. You know, you're going to need to be patient with that friend.
Yeah.
You know, you may have made all these wonderful plans, and then that friend last minute calls you and says, you know what, I can't.
Yeah.
That takes a little patience, and you might feel a little bit hurt, frustrated. That's okay.
Yeah.
You know, but being able to communicate with them honestly about where they're at and what they need, I think is a really good start. And then of course, you know, hey, let's see if we can find somebody to help you out. Let's see if, you know, if there's anything in the local area, maybe you want to go be evaluated, maybe, you know, on and on. But I think just being there and being a friend and listening to them on what support looks like for them. Instead of putting yourself through the hell of doing all the like guesswork about, I don't know, should I push, should I back off, you know, just ask them. You know, what is it, what can I do right now that will be most supportive of you?
I think that's really great, and I think that's one of the struggles with people with social anxiety, with depression, with the mental disorders that kind of isolate you away from other people. People just view it as, oh, well, that person doesn't want to hang out with me, so
a loner, or
I'll just move along, and then they get left alone.
Right.
And in their own mental illness and struggles, and they don't have anyone to talk to. So it is a struggle, and I think those are great suggestions as to how to help them, because we have to be there for our friends.
Thank you for being a part of our PAWSCAST. This Health and Wellness podcast is brought to you by the Prevention Center and Peer Education Network at Frostburg State University. If you would like more information about our programs, visit us in Pullen Hall, room 109, or call us at 301-687-4761. Or you can always send us an email at safeoffice@frostburg.edu. Remember to watch our other episodes and stay tuned throughout the semester. Thank you!